welcome to all my viewers around the world. If this is your first time joining us, welcome. I'm glad to have you. To all my returning subscribers, welcome back. Thank you for coming back. Today, we will be looking at common lab tests that go along with your annual physical examination. Remember, we discussed annual physical examination last week. This video will conclude the series on annual physical examination. The first lab work we will be discussing is called complete blood count, also known as CBC. CBC measures the types and numbers of cells in your blood. These cells are the red blood cells, the white blood cells, and the platelets. It helps us evaluate symptoms that you may have, such as weakness, fatigue, or you have bruises all over your body. We could also use CBC to diagnose certain conditions such as anemia, leukemia, malaria, and infection. The next lab is the comprehensive metabolic panel, known as CMP. Your CMP looks at your electrolytes, your kidney functions, and your blood sugar level. We use it to look at your electrolytes such as sodium, potassium, calcium, chloride, carbon dioxide, blood urea, nitrogen, and creatinine. These two look at your kidneys. We also use it to, like I said earlier on, to look at your blood sugar level. Through your comprehensive metabolic panel, we can look at your electrolytes or your fluid imbalance. Your PCP could also use it to monitor the effects of certain medications you are taking, especially high blood pressure medicines. If you're on diuretic or water pill, we use it to make sure that your potassium is not low, and if it's low, we can replace your potassium. For this particular test, we want you to be fasting at least 24 hours before the test. If you by 12 midnight you don't eat, if you're going to have the test in the morning. The next test is the lipid panel. The lipid panel, we use it to evaluate your cardiac risk, and this is where we include your cholesterol. We look at your cholesterol, we look at your triglyceride levels. The next test is called the liver panel. Liver panel looks at your liver. We use it to assess your liver function and make sure you don't have any disease going on or any tumors going on. Then we do the thyroid stimulating hormone. The thyroid stimulating hormone, we use it to screen your thyroid as well as monitor the function of your thyroid. Vitamin D is another test that we recommend as your annual examination. Vitamin D is needed more importantly, or most importantly, now that we have the COVID-19 infection. Vitamin D actually helps with your immunity, helps you to fight infection. I have a presentation I did on vitamin D on my Instagram. Please check out my Instagram on vitamin D. My Instagram name is MedHour Stella, MEDHOURSTELLA. It gives you a comprehensive information on vitamin D. And also watch my Instagram page. That's where I give out information on health and also other health tips that you may need. The next lab that I will want for your primary care provider to do as your part of your physical, your yearly physical, is the hemoglobin A1C. Hemoglobin A1C is used to diagnose and monitor your diabetes. We sometimes use it for patients that are overweight, patients that we think that are pre-diabetic or at increased risk of diabetes. Then finally, the next test we do is the urinalysis. Sometimes urinalysis with culture. We use your urinalysis to monitor early signs of diseases such as diabetes or kidney disease. Most times we look for urinary tract infections. If you have a urinary tract infection, then we do a urine culture. In this culture, we're using it to determine the organism that is causing your infection so that we can determine the appropriate antibiotics to use for the treatment. If you can get your provider while doing your annual examination to do all these tests, you've actually completed your annual for the year. I'm going to do a brief roundup of the tests you need to do. The first one is your complete blood count. The next one is comprehensive metabolic panel, the lipid panel, the liver panel, the thyroid stimulating hormone, vitamin D, hemoglobin A1C, urinalysis, with or without the culture. If you've done all these things with your physical this year, you've actually given yourself the greatest gift you can give yourself, which is your health. Remember to check my Instagram to see where I post all the health information and health tips, as well as sending in your questions. If you have any questions that you need me to answer or any concerns you may have, please reach out to me through my Instagram. I will see you at the next segment. Be well.